everyone, welcome back to Missi Care Online Health Talk. Today we're talking about arthritis, something that a lot of us are facing. Start with, we have to know what is arthritis. In medical term, anything end with the itis means inflammation, and in this term, arthro is joint, arthritis means inflammation of the joints. So with the cardinal signs of swollen, painful, and sometimes redness around the joint area. And it may at times involve more than one joint at a time. There are almost more than 100 types of arthritis that we have known, and they're affecting millions and millions of people worldwide. It can be associated with the systemic disease, not only disease pertaining to joint, but also is as a manifestation of a systemic disease, for example, psoriasis, inflammatory bowel disease, or some other autoimmune disease, for example, systemic lupus erythematosus, SLE. Now, this is the structure of the joint. For a healthy joint, you can see that as the diagram here, this is one bone, the other bone joined together. There's a space, healthy space between these two bones. And end of these bones, there will be lining of cartilage. Right? And holding this joint together, the first layer is called capsule. It's a very strong enclave that hold together the joint. And the inner lining of the capsule is called synovium cells, which secrete synovial fluid as a lubricant for the joint. And on top of that, these joints are held by muscles and tendons to move the joint and also to keep the joint stable. Now, what are the common symptoms of arthritis? Most common one, of course, are joint pain, stiffness, or swelling. It may be worse in the morning, and because of the pain and because of the swelling, limit the range of movement of the joints. And sometimes when you bend the joint, you can hear the clicking sounds. Now, the muscle around the area can be very weak because of the joint pain. We tend to limit the usage of the joint and eventually cause wasted muscle and cause muscle weakness. And because of this fluid and because of the muscle weakness, the joint tend to be unstable. And in certain cases, they have a bony growth in the fingers or even over the knees. You can see the protuberance of the bone. Now, elaborate a little bit on rheumatoid arthritis. It's something very common and debilitating arthritis. The symptoms typically involve morning stiffness, can last up to half an hour or more early morning, and usually affect more than one joint at one point of time. And usually onset in the smaller joints, for example, toes and hands. And usually presentations in symmetry, that means left side and right side together. And associated with the systemic symptoms, for example, fatigue, tiredness, and sometimes they may have low-grade fever, and they tend to have dry eyes and dry mouth as part of the associated symptoms. And they may involve inflammation of the heart vessels and also involve inflammation of the heart itself. And they tend to have a low hemoglobin, or we call it anemia. Now, what are the causes of the arthritis in general terms? And because of the wear and tear, as we age, we work too hard, we walk too much, with certain part of the hand in a certain job nature, and so there is a wear and tear and causing the joint of overuse. Aging, the commonest causes is osteoarthritis. So because of the age, the wear and tear, the joint become age, and commonly occur after age of 50. Now, at the young age, we have injury to certain part of the joint, it will cause chronic arthritis problem. Obesity, because it exerts a lot of gravity weight on certain part of the joint, especially knee and hip, and eventually cause a severe arthritis at the later part of life. Certain autoimmune disorder means that the immune system attacking our own cells, they tend to attack the cells around the joint and cause arthritis. Certain family history and the gene makes certain people more susceptible to arthritis. Muscle weakness, as I mentioned earlier, the muscle weakness, certain disease affecting muscle weakness, or for example, stroke, will cause weakness of the joint, and it can't hold the joint together or in terms of structure and also the function wise, and it will end up arthritis as well. What are the risk factor for a person to get arthritis? Now, obesity, obviously, as mentioned above, as cause of the arthritis, and because added stress on the weight-bearing joints. Age and gender. Now, as we age, the arthritis risk is increased. Women tend to have arthritis problem more than men, except gouty arthritis, which is more common in men. Overuse injuries, job nature, certain job nature, for example, a butcher, tend to may have the nerve problem and also a joint problem over the hands area. Sportmen, for footballer, tend to have the knee injury and cause knee arthritis. Certain genetic make someone more preponderance to get arthritis. Smoking, for example, smoker tend to get rheumatoid arthritis with those with the underlying gene. Now let's talk about osteoarthritis, one of the commonest arthritis that a lot of us are facing. It's the commonest type of arthritis affecting millions of Malaysians. Of course, it's more common in women and usually happen at the age of 45 or even 50 onwards. You can see here, that is the arthritis knee. They bend it like we call it vulgaris. The knee are bent. Now, the pathology start with the roughening of the cartilage. The cartilage is the end plate that covering the end of the joint, especially in the knee. And eventually, there are tiny bits of extra bone we call osteophyte growing at the end of bone within the joint. And that can be increased in the amount of thick fluid or synovial fluid inside the joint and subsequently reduce joint fluid. The joint capsule can stretch, and because of this, the joint can lose the shape and distorted. And commonest part or area that affected with osteoarthritis are knees, hands, hips, and the back. You can see the diagram here. They tend to have an extra bone spur we call osteophyte over here. The joint space also reduced because of the cartilage damage, and the synovium can be inflamed, thickened, a lot of inflammation going on, and the cartilage no longer smooth, so it cause a lot of pain when we move the joint, and the capsule also distorted in shape. So one of the tips about osteoarthritis is that keep active when you are young. Healthy weight and regular exercise can delay onset of arthritis or even we can avoid in the lifetime. Now I can see the x-ray from here. This is the typical changes of osteoarthritis. You can see the abnormal bone growth here, the spike here, and a lot of thickening, inflammation, and cause scarring over the cartilage area we call sclerosis. And there's a reduced joint space. And how we stage osteoarthritis based on the degree of the damage over the joint area from stage 1 to stage 4, which are the worst and most severe. The other commonest arthritis is rheumatoid arthritis. We have commonly heard about RA. It's a type of inflammatory type of arthritis, and it's autoimmune in nature. It means the antibody can't recognize our own joint cells and attack it as abnormal cells or pathogen. The inflammation and extra fluid in the joint cause moving of the joint difficult and painful. Chemicals in the fluid damage the bone, erode the bone and the joint. This extra fluid also stretch the joint capsule and change the shape of the joint. These chemicals in this extra fluid irritate nerve ending and cause severe pain as well. Now, it can cause permanent damage to the joint. Now, it commonly affects wrist area, cause a lot of redness, pain over the wrist area, thickening, swollen, and morning stiffness over the wrist area. If you can diagnose early, start the treatment early, you can prevent further damage to the joint. So the common symptoms are swollen and tender joints, and there's a swelling and stiffness of the hand joint in the morning and cause morning stiffness, and associated with the severe tiredness and fever. Often start in the small joint of the hands, for example, and feet, and usually both sides symmetry. It can be gradual or aggressive form and cause acute attack of the rheumatoid arthritis. It affects adults of any age, commonly occur between 40 to 60 years of age. It's more common in women than men. I can see there are a lot of deformities and a lot of description in the deformity. For example, one of the commonest findings in deformity over the fingers area are swan neck deformity. That because of the damaged joint and the pulling of the tendon, it caused this particular shape we call swan neck deformity in rheumatoid arthritis patient. And you can see diagram here, it erode and eat into the joint, cause severe damage. And because of the attack in the synovial, caused a lot of fluid secreted into the joint area, cause swelling of the joint, and even distort the shape of the joint. And you can see this is quite a severe stage of the rheumatoid arthritis over the hands until it impaired the function of the hand. They can't even button their own shirt, they can't even fit themselves. So it's a very debilitating disease. And look at the x-ray from this hand. Most of the hand joints are already distorted and dislocated as well. Now, there are slight differences between rheumatoid arthritis and osteoarthritis in terms of the common site they're attacking. You can see here osteoarthritis tend to affect hip, knee, sometimes fingers. And for the back spine, it tend to affect cervical, neck area, and also lumbar area. Right? Whereas in rheumatoid arthritis, it tend to be symmetry, tend to start with the wrist area or small fingers. And some that go to the both elbows, and it may attack both shoulder as well, both knees, and sometimes small joints over the feet area. The other arthritis, again, commonly encountered is gouty arthritis. Again, is an inflammatory type of arthritis, affect commonly big toes, wrist, ankle, although other sites are possible, and they are not usually symmetry when the attack comes. The gout arthritis typically manifested as a red joint, very red, hot, tender joint, and shining in surface. It's usually caused by having too much of uric acid or urate in the blood. And this urate deposit as crystal in the joint space. We call it acute gout attack. What are the risk factors? Overweight, and with the genetic family history, high purine diet, for example, anchovy, red meat, seafood, alcohol drink, all these can precipitate any gout attack. There are medications to reduce the amount of the urate in the body and prevent the gout attack. For example, aripiprazole, fibrostat. During the gout attack, we use different type of regime. We give painkiller like NSAID plus colchicine to dissolve the crystal in the joint space. Men can get gout from their early mid-20s. However, women tend to get it usually after menopause. Now, this is a typical site presentation for gout attack. It's the base of the big toes. We can see the uric acid deposit there. And a chronic deposit of this urate into the joint, we call it tophi. You cut it, you can see a lot of chalk-like material accumulating over the joint area. This is called tophi for gout. The other common type of arthritis is psoriatic arthritis, which is associated with the particular skin disease called psoriasis. Again, it's an autoimmune condition. Dysfunctional immune system cause painful swelling and stiffness around the joint, as well as red scaly skin rash called psoriasis. The rash can affect several places, for example, elbows, knees, at the back, buttock, and the scalp hairline. Usually affect people who already have psoriasis. However, this type of arthritis can even appear before the skin manifestation. In rare cases, it's reported that this arthritis can appear without presentation of the skin lesion. Now, this condition can affect any age but tend to affect adults. You can see the diagram here. They have a scaly skin lesion over the hand area, shoulder area, and the scalp hairline area. Another common arthritis that we have seen is lupus arthritis as a part of the symptoms of presentation for SLE, or we call it systemic lupus erythematosus, which is an autoimmune disease commonly affecting young women, especially like, for example, Chinese population. And the immune system mistakenly attack our own healthy tissue. It may affect and attack tissue from the heart, lungs, kidney, skin, joint, etc. It affects kidney, will cause kidney failure, and if you don't treat it early, And joint pain and swelling is very common, particularly in the small joints of the hands and feet, and associated usually with fever, long chronic fever, long-term fever, the hair loss, mouth ulcer, etc. And sometimes they present with rashes, and the commonest rashes that we find is over the cheek area. We call butterfly rash, that's illustrated in this diagram. And joint pain move around from one joint to another, is migratory in nature and affecting 20 to 40 years of age, and definitely female much more common than male gender. You can see from this diagram rashes over the hand area, and it may be associated with the vasculitis changes over the palms of fingers. Now, what are the treatments in general for arthritis? The goal of treatment is, of course, to reduce the amount of pain, to prevent additional damage to the joint. And use medication, sometimes you can use supplements to control the pain and inflammation. Physical therapy, occupational therapy, regular exercise, nutrient-rich diet, weight loss if needed, heat and cold compress, and sometimes we may have to use mobility assistant device such as cane or walkers. Now, we go through one by one. For tablet or painkiller, for a mild one, you can use common analgesia, for example, paracetamol, we call it Panadol. And severe form or more severe form, we tend to use a stronger painkiller, we call it NSAID, non-steroidal anti-inflammatory drugs, such as Votrient, ibuprofen, or even salicylate or aspirin for pain and also anti-inflammatory effect. And certain creams may be useful when you apply on the painful area, for example, NSAID cream and menthol cream. In severe cases, we have to use steroid to control the inflammation, to suppress the inflammation, like for example, prednisolone. Help to reduce inflammation, but have to be used cautiously with the advice from doctors. Severe cases, we use immunosuppressive agent or biologic agent to suppress the immunological response. For moderate or severe inflammatory arthritis, for example, rheumatoid arthritis, RA. And in RA, we tend to use a lot now, we call it disease-modifying anti-rheumatic drugs, DMARD, which suppress the immune system in rheumatoid arthritis patients. In certain cases, we have to resort to surgery to replace the damaged joint with the artificial one. For example, we may replace the hips or sometimes replace the knee as well. And in severe cases over the hand joint area, for example, we have to perform a certain surgery called fusion of the severe hand arthritis. That means we no longer need the joint, we fuse together so that there's no more joint space, no more inflammation ongoing, to reduce or to omit the pain totally for the patient. And physiotherapy is very useful for arthritis. Exercise that helps to strengthen the muscle around the joint area, to build strength and build facility and build balance back to the patient to improve the mobility while also preventing falls. Now, the other part, regular exercise. There are certain regime for certain type of arthritis to keep the joint flexible, and usually we recommend non-weight bearing exercise, for example, swimming, cycling, or brisk walking, not so strenuous to the joint, in particular to the knee joint. Yoga, Tai Chi, or Pilates are few that are good exercise to help arthritis. Staying active is important. The other thing that have to go for the lifestyle change is stop smoking. Like for example, in rheumatoid arthritis, smoking has been proven to worsen the outcome of rheumatoid arthritis. Now, losing of any excess weight is good for any joint pain, in particular those arthritis involving weight-bearing joints like knee and hips or even ankles. You have to eat a very nutrient-dense diet in terms of weight loss and lots of antioxidants, for example, fresh fruits, vegetables, and herbs to reduce the inflammation. And we have to avoid or limit certain foods, for example, fried foods, dairy products, processed food, and we have to reduce the intake of meat. Gluten-free diet may improve symptoms and disease progression, as gluten antibody may be present in patients with rheumatoid arthritis. Now, certain food are quite useful for arthritis. For example, turmeric, curcumin, cherries, pineapple, ginger as well. And certain food with high in omega, for example, chia seed and flaxseed. And raw apple cider vinegar also are quite useful for arthritis patient. Right, thank you. Thank you for your attention. We shall proceed with another topic next one. Thank you.